No. If you have any questions or comments, please put them in the chat. You are not unable to unmute yourself, but if you do have a question, you can also raise your hand if you click on participants, and a box will pop up on the right-hand side, and the raise hand function is at the bottom right of that box. If there is any disruption that we are unable to manage over the course of this meeting, we will end the meeting for everybody and follow up about rescheduling or sending out the remainder of the information at hand. We don't anticipate this happening, but we're just sharing in the event that it does. Thank you for joining us, and with that, I will pass along to Barry Keppard, our Director of Public Health.
Thanks, Sasha. Thank you, appreciate that. I just give my thanks to everybody else who's joining us today too, and particularly extend my appreciation to Elaine Zhang from the public health team here who's with me, who really helped organize today's webinar. So for the introduction, I guess I was thinking that occasionally in these moments when we're asked to do something new or maybe to do something different, I think a model that I often tend to think about, what are the comparable models? What are those ideas that were already out there that we might be able to kind of change around or combine with other pieces? This idea that ideas already exist and kind of concepts have already been tested. They might come from a different field, but they might have real relevance to where we are now. And I think if we look at these past few months for the pandemic, but we think about this last week in particular, it really kind of drives home the evidence that any kind of recovery we will engage in really requires recognizing underlying trauma and the unjust burden that exists on a number of us who are within the region, people who live in the region, but also throughout the world and the nation. So lucky enough today, we're really fortunate to have Ken Epstein from Trauma Transformed join us to kind of share some of those ideas and thoughts about what it means to take into trauma and to think about as we heal our communities through any kind of recovery. I think many of us might be encountering some of these ideas for the first time. In other cases, we might be finding them out to kind of deepen our understanding of it. So I'm just really excited as well for myself, because it's a bit of kind of personal and professional growth to learn about these topics. And so really appreciate the opportunity for Ken to join us. So welcome, Ken, and I'm going to turn it over to you.
Thank you very much, Barry. And before I show my slides and share my screen, I just want to say to all of you, and Barry, you and your team, I'm aware that you have been doing probably work 7 days a week, 24 hours a day to keep the community safe. And, you know, you went from doing one thing to doing another, and I just have enormous gratitude for what you're doing around keeping keeping our community safe, and what you do every day. So I'm going to share my screen and begin here, folks. So I have, better part of 40 minutes to tell you too much and speak too much, and then get your questions and give some answers. So we're going to cover a really wide swath of information, and I'm sure that some of it will resonate and some of it will create more questions. Before I start, I just wanted to, besides welcoming everybody to the webinar, I wanted to introduce myself a little differently. And because I do that, leadership is something that's earned and learned from mentors and teachers, and always, always, always starts with who we are. Locating ourselves is central to recognizing our bias and leading with our eyes wide open. And now more than ever, this is true. It's always true. I am a lead. I've been a leader for the better part of 35 years. I'm a social worker. I'm the middle generation of 3 generations of social workers. I'm white. I'm originally from New York. I'm Jewish. I'm middle class. And I'm cisgender male. There's probably a lot more to say about me and my life in the Bay Area, but I introduce myself that way to say that everything I do and everything I say today comes from that bias. How I look at the world, everything I say today. And I assume that I will say things that for you don't match your experience, your background, your culture. And I find that helpful, not hurtful, because that's how we get into dialogues that increase our capacity to understand and lead. We're collectively facing really an existential moment, not that there haven't been others, but this moment defined by a disease that as yet does not have a cure, a treatment, a vaccine. As scientists work on trying to solve the pandemic, leaders such as yourself in healthcare and other fields have been working on how to face this existential moment. We must lead a response that concurrently keeps our communities safe, our staff healthy, and responds to a changing landscape day by day and moment by moment. Uncovered, not surprisingly to all of you by this pandemic of COVID, is the simultaneous pandemic of racism and structural racism. Were we ready? How did we respond? How will we recover? And will we experience renewal? I don't know about you, but my leadership training, my social work training did not spend time having me answer those questions, but yet we all are faced with that right now. Before I move to the next slide, I want to give a little trigger alert. I'm going to show you pictures of Mr. Arbery, Mr. Floyd. And you know, these pictures are, and their names are important and necessary to start with. So my trigger alert is I'm going to move to the next slide, and there'll be pictures of the 3 most recent murders of African Americans. Breonna Taylor, Ahmaud Arbery, George Floyd, and so many others before them. So many Black, African American, beautiful folks have lost their lives due to systemic and organized and historical racism. I want to just spend a moment reflecting, looking at them just for a moment, putting ourselves in whatever place we need to be to understand that we are in a time, in a moment of deep grief, rage, and my hope, opportunity and inspiration to once and for all confront our original sin as a country around the genocide of Native American people and the slavery of African Americans, and that legacy that has so defined all of our democracy and all of our country for 400 years. We need to say their names. We need to bring this to everything we do. Nothing can be done without addressing structural and systemic racism. And as a white person and a white male, that responsibility is ominous and challenging and important and critical. Needless to say, much of what I'm going to say today speaks to how we got here. We're in the COVID storm, and many people understand the COVID storm as, I've heard people say, we're all experiencing adversity. I know in my city, that same storm got our public health departments regionally, locally, and our governor to act in ways I have never seen us move faster. I've never seen more barriers removed. I've never seen more red tape removed. I've never seen us act more uniformly. And we are fortunate by that behavior of those folks that this storm hit the Bay Area differently than other places. And at the same time, it made me wonder why we haven't been able to move in the same way for different storms that have happened over time. And I hope we keep in mind during this talk that there are some things in this storm we need to translate to our ongoing work, because we are in different boats. As I sit in my house with my privilege, I don't face the kinds of disparities, inequities that COVID, as it strikes Black and brown folks and racism as it has been historically embedded into the inequities of our system. And the merger between those two will be clear in this talk. We are not talking about a different storm, but we are talking about different boats. 3 objectives for the training. I saw in the beginning that you all have limited or no understanding of trauma-informed systems. I think by the end of the talk, you'll probably say, oh, I knew about that, because I'm going to say things hopefully that resonate with you and make this more plain, as opposed to more sounding as if it's some initiative you don't know about. And I want to talk a little bit about what we call the 4 R's, which are the phases of the pandemic, and the 5 C's of leadership, and then provide an example of what's something that's happening in San Francisco as a way of applying some of these principles. So our work starts with 6 principles. Now, there is nothing sacred about these principles. They are the principles that we started our work. Every organization needs to have a set of principles that are related to relational healing. These principles are embedded in an organization that I worked with and where I was the architect of trauma-informed systems. I helped build in the Department of Public Health a model of organizational change that was based on understanding trauma. And these principles, cultural humility and equity, collaboration and empowerment, safety and stability, compassion and dependability, resilience and recovery, if you think about them, they're really just saying, how do we heal? And what are the components that we want to embed in our system around healing? And also, I want you to notice that these principles are not adapted or adopted from a profit-bearing business. We are not talking about productivity, efficiency, or deliverables. We're talking about the underlying ways in which our organizations need to be focused and operating. So just a little bit of a story about trauma-informed work. We know that trauma has been understood, well, it's been understood forever, but it's been understood by maybe psychologists since the days, or psychiatrists since the days of Freud. We understand that trauma is something that happens to individuals when they've experienced an event or a series of events that has impacted their capacity to function or operate. We also understand that trauma impacts families, that it can run through families, that families can have experiences and it can be passed from generation to generation. And we know that communities can experience collective trauma based on historical and or structural inequities, or things that happen to communities such as schools or communities where there's violence. What we now know is that organizations can experience trauma, that the same symptoms that you see in individuals, families, and communities are actually present in our organizations. Now, I don't know about your organization, so some of these words may not have meaning to you, but we coined this term trauma organized with Sandra Bloom, who's one of the founders and originators of a trauma-informed systemic lens. And you notice in your organizations, when you're trauma organized, organizations are reactive. They relive and they retell things that have gone on. I know when I started in Department of Public Health, people told me things that had happened 20 years ago, as if it had happened today. Disputes between staff, and even as new staff came in, they'd be trained in the ways of the organization, almost in ways of passing on the trauma from one generation of staff to the other. Avoiding and numbing. When I'd meet people early on in my tenure, and I'd introduce myself and I'd say, hi, I'm Ken. And they'd say, yeah, hi, John, I'm retiring in 3 years. I'd say, oh, well, now what do I do? And how is it that really mission-driven people decide in the first 5 seconds of meeting you that they need to tell you what they're doing in 3 years in terms of retiring? How does that happen to a field so built on our passion and our mission? And we know that we're fragmented. In our department, sometimes the IT department is at war with the HR department, who's at war with the compliance department, who's at war with the programs department, and we just accept these divergences in our organization as part of, oh yeah, don't talk to them. You won't get it done. And there's all sorts of inequities in authoritarian leadership. And what this you know, the point of understanding whatever the symptoms or the ways in which your organizations operate, or you see this in your own leadership, is that it induces trauma in the organization. And you begin to see the symptoms of that by virtue of this reactivity and this reliving and avoiding in the organization. Trauma-informed, you know, is very popular. It's the idea really that understanding the nature and the impact of trauma will lead towards us better understanding how to work with folks, and that we have a shared language, and that implicit in that and explicit in that is that we need to always include, when we're talking about trauma, sociocultural trauma and structural oppression. And that's really involved in training people so that you can have a shared language. When I was at the Department of Public Health, we built a curriculum for 3 hours. The director of health, Barbara Garcia, who was quite a visionary, determined that everybody in the department would be trained in this. And I'm proud to say, to this date, about 8,500 people of the 9,000 people have been trained in a 3-hour trauma-informed systems training that really goes through everything from the neurobiology to implicit bias and explicit bias to all of the principles that I showed you before. And that's like a railroad station on the way to a healing organization. Because being trauma-informed and training people is a little bit like what I'm doing today. I call it train and pray. So I'll train you, I'll do the webinar, and it will end, and I'll pray that it had any meaning to you, or maybe you weren't emailing or, you know, on the phone at the same time, and you know, and that maybe something had some meaning to you. It may not, but that's the train and pray method. So when you bring even 8,500 people to be trained in the Department of Public Health in San Francisco, that doesn't mean their behavior is going to change. We have since trained many, many systems, over 20,000 people. We've developed train-the-trainer programs, champions, leadership learning communities, and all of that's part of the change process, which I can talk about more later. But the point is that to be a healing organization, and why we want to be a healing organization, is because we actually don't make widgets. Often, I know my experience working for public sector and nonprofit organizations is that we often borrow from for-profit industries. You may be, you know, familiar with Lean from Toyota, or, you know, other methodologies of organizational change that were built on organizations that make cars or computers. And that's all good. And I think there are some great concepts in it. It's a both and, not an either or. But there's a profound difference between what we do and what Toyota does. What we do is we heal people or communities or families. No matter where we're located in an organization, whether we're on the policy, the IT end. In San Francisco, we had IT people that chose to work at our department as opposed to Google. So no matter where you are in our organization, the mission is to heal. So if we're a healing organization, we ought to adopt language and measure our progress based according to healing, as you would in any relationship. So like if I have a relationship with somebody else, I know I'd like them to be moments of reflection, because from reflection comes change. Do your organizations have places where there's reflection? Do you reflect on data? Do you have reflective meetings? You need to make meaning out of the past, not just say, oh, we're not going to do that anymore, restructure and do it differently. But how is it we keep ending up in the same place, even as much as we restructure? There's the old CEO joke where one CEO is leaving and gives the new CEO 3 letters. And she says to the new CEO, when you get in trouble, open the 3 letters. So the CEO opens the first letter when she's a year later after being there, and it says, blame your predecessor. So she blames her predecessor, everything's going great. 2 years later, she gets in trouble. She opens the second letter, it says restructure. Everything's going great for 3 years. 3 years later, she opens the third letter, it says write 3 letters. We don't make meaning of the past, we repeat the past. Growth and prevention oriented, so that we're always thinking about our readiness to be growth oriented, collaborative. Equity is not a plan, but it's incorporated and centered into everything we do. It's not a plan we check off, but it's something we do, and we ask ourselves that question around every policy, every procedure, every hire, and everything we do. And at the bottom of that is relational leadership that we'll be talking more about as I go further. But that healing organization concept, why we think that is because it reduces trauma. And imagine this, if our organizations are inducing trauma in our staff and our organizations, how are we going into communities that are traumatized and reducing their trauma? So concurrently, while we're healing our communities, we need to heal our organizations. And just like any relationship, it takes a lot of work. Last thing I want to say about trauma is you may have all heard this, but so the coining phrase, which is often very helpful to people, is that when you're trauma informed, you move from asking questions about what's wrong with somebody or an organization or a family or community to what's happened to them. And when you just change that lens, what happened to that organization? What happened to that person? What happened to that family? You can even say that around what happened that people got so rageful that they're in the streets right now, as opposed to some of the news reports. What's wrong with those people that are breaking windows? Not that I'm condoning it, but the question is, what's happened? And when you start to ask yourself the question, what happened, you come up with a much more complex and much more nuanced and much more important answer, which may lead and reduce trauma. I want to quickly acknowledge some things. We've talked about them, that we're fighting a disease with no treatment or cure. We're holding a multitude of feelings, fear, joys, all at the same time, and they're all different. There are many responses to stress and uncertainty. Each of them are valid. Some of us get really aggravated and have short-tempered, or we have the COVID sleep disorder. Others of us are more like motored and doing things, and some of us are really sad. All of that's happening at the same time, and they're all valid, and we're living in a time of uncertainty. There's a critical need, even in response, for reflection, inquiry, and prioritization, and there is no better time to practice compassion than now. And we'll talk about that in a bit, and the pandemic is new, but as we can see day by day, the inequities that en masse are by no means new. So I'm going to quickly go through this. What do we know about? Well, basically, if you want to sum this up, we know that our workforce and all of us and our communities will suffer from stress and trauma from all that's happening since COVID-19, right through the murders of our African-American citizens and what's happening on our streets. We know from China, SARS, that these anxieties lead to increased experiences of stress and anxiety and suicidal depression. And already the healthcare field was high in these areas. We know that we're worried about family members. That worry increases, and our past medical or chronic history may be a problem. We also know that there are things we can do. That, PPE or breaks, deployment, post-deployment care, and supervisor empathy. Empathy, real empathy, actually buffers and mitigates trauma and stress. So if you're sitting out there and saying, oh, this is inevitable, I'm telling you, right now, you can actually do something to buffer it. So we see the pandemic in 4 phases. The first 3 are borrowed from the Missouri model, Readiness, Response, and Recovery. And the 4th is taken from educational violence about renewal. And I'm just going to go through them because this has been often an important frame to understand about where we are. And before we talk specifically about any of the pandemic phases, we need to talk about grief. There's been some great articles and talk about that we have collective grief right now, loss and rage. I've heard many people say, oh, I feel bad that I'm worried about my child's graduation because I have so much going for me and it got canceled, or the wedding that got canceled, or I don't have a trip I could go on because there are such greater needs around people being hungry. And all of this is happening simultaneously. It's not an either or. I can't feel my grief because the grief for someone else is greater. If I don't feel my grief and acknowledge my grief and acknowledge it for myself and acknowledge it with my staff that we are collectively experiencing grief, it will metabolize in our bodies and it will lead to stress and poor sleep and guilt and blame and loss and spiritual loss and hopelessness. So one very important factor about all of this is to understand that grief is embedded in everything we're doing right now. We're experiencing grief. It's not all we're experiencing, but it is overwhelmingly true that grief is all around us. First stage is readiness. And the thing about this stage is that you ask yourself, were we ready for the pandemic? And I think there's another whole set of questions to ask. Were we ready for the shelter in place? Were we ready to understand the inequities that it would create? Were we ready for what would happen when we sent our workforce home? Were we ready for the response to the police shootings? Were we ready to understand how we might collectively respond? And when you ask those questions, not only were we ready for the pandemic, you begin to think about what have we learned and what do we need and how do we stay ready for this next wave, whatever it is. The first phase is readiness. The second phase is response. And some may say we're still in response. And this phase is really marked by really reducing stress and reassuring, prioritizing communication and planning. It's really about safety and survival and basic needs. And embedded in it, and I think Barry, you said this before, effective communication. Some people use the words the new normal, including social distancing, but how do we communicate? I know that in my experience, there's also a pandemic of information. I call it an infodemic. I mean, I have gotten more things about how I should cope that I start to get pissed off when I get more coping mechanism websites to go into because they're not touching the level of, and it's overwhelming to try to think about all the ways I'm supposed to cope for myself. So thinking about what are good communications and how our thinking is during this time, because during the response phase, there's only so much information we can take in and metabolize. The pandemic outset, there's communication, there are tipping points, certain factors that will either increase or decrease our fear, and surges will really impact our self-care and our peer care training. I was coaching somebody the other day that was saying that they've been, since February, they've been working 16-hour shifts, 7 days a week. And they just had lost track of how life could even be normal. They were in this hyper-vigilant state. And even when they tried to relax, they couldn't. They wanted to go back to work. It's like being on the front lines and stepping off and realizing you just can't step off. And we have to help people understand that because that can become a permanent part of their structure. So as leaders, why I'm showing you these phases, because they're not just phases of what are our checklists around readiness and response, but what are the psychological impacts on ourselves and our staff, and how do we address those in real time? The recovery phase, some people might say we're starting to get into the recovery phase. This is when we're thinking about returning to work, putting supports in place, thinking about grief and bereavement, and using our partnerships around recovery. It includes return to the workplace. We've been working here on a workplace return and recovery checklist. Now I know the CDC, and there are all these different checklists about having people sitting 6 feet apart, having plexiglass, taking people's temperatures. What I haven't heard people say is, what do you need to do on the first day when somebody walks back into the work? How do you greet them? How do you ask them how they're doing? How do you notice the folks that are really worried? How do you talk to the people that are afraid to come back to work or unwilling to come back to work? How do you balance the community wellness and the staff wellness and supports? It's a whole nother checklist that we're working on, which has to do with how do supervisors manage and understand that there's the return to workplace is not a checklist of logistics. It's a checklist of also human experience. And when you take a trauma-informed and relational perspective, you think about what do you need to do when you help people return to the workplace. So these are three key, this is for your, for your toolkit, your toolkit. Here's three key questions about workplace return and recovery. What are the key components of return to work? What are the key communication strategies? Who communicates? Already, I've worked with systems where there are 6 different complicated and confusing and actually often different communications about return, when they should, when they shouldn't. They're gonna on this day, and no, they're not gonna on this day. And how will you, as a leader, influence the process? These would be parts of my checklist. Then the pandemic renewal phase is during this time, we've all discovered things that actually we want to keep doing. Maybe we've discovered systems that were unnecessary, or meetings that were unnecessary, or emails that were unnecessary, or we developed new processes to get things done easier and quicker. I know that there were things that happened in San Francisco I could have never imagined happening. We couldn't figure out how to get hotel space for homeless people, and in 6 days, not only did we have hotel space, but we had support staff in all of the hotels. Now, it took an enormous effort, but when you can, maybe there's something in that we need to have a greater appreciation of and see that there's new possibilities. So holding in mind, and some leaders are actually keeping a list of, oh, here's the things that I want to remember, because once you go back to homeostasis, you just return right back to the way it was. So we've learned some things in the pandemic. Now, these phases are all important because you may all be in different phases. If I was to take a poll now, which we don't have time for, some of you may feel like you're in the readiness and response phase, or the recovery phase, or the renewal phase. You may feel you're in multiple phases. But I ask you to look at it because they're intersecting. Where are you? And where's your staff? And what happens if you're in the response stage and your staff is in the readiness stage? Or what happens if you're saying, hey, we're recovering, and somebody is still feeling the hypervigilance of the 16-hour shift of the deployment? The answer is that one simple question to ask people is 3 parts, and it takes 15 minutes, maybe 10 minutes, is a check-in. And it goes something like this. The first question you could ask is, how are you holding up? As opposed to asking, how are you, which is the way of the world, how you're holding up assumes adversity. And I could answer it by saying, I'm doing okay, or I'm not doing okay, or I got something going on at home. This is not therapy. This is a check-in. The second one is, what's on your mind? Because anything might be on my mind. And right now we are more distracted than can be. I mean, yesterday I was doing a webinar, and my mom, who's in New York, texted me a picture of a protest outside her house. That was distracting to me. If you asked me what was on my mind, I would have told you, oh, I'm seeing this text of my mom who's, 86 and alone, and trying to figure out far away how I might handle that. Knowing that is helpful. It doesn't mean you need to fix it, but it does help me focus. And the third question is, as opposed to fixing it, how can I help, or what can we do to collaborate to get you focused on what we need to do here? What would be helpful? Not telling them their coping mechanisms, or to take a day off, or to breathe deep, but what works for them. So quickly, because I don't have time, all of these tools are on our website at traumatransform.org. There's a section for a pandemic, or response to mass trauma. We developed a leadership guideline with 5 C's: clarity, cohesion, connection, communication, and courage. And it really restates how you would operate in these 4 phases. Clarity, really, and it gives you some do's and don'ts. I'll just give you an example. A do is, really keep staff up to date with clear, accurate information. And it means you're going to have to repeat it, and then repeat it again, and then repeat it again. Because I hear more and more and more, I never heard that. I told you, I never heard that. I told you. Well, don't get frustrated that it hasn't been heard. It needs to be repeated. And one of the reasons it's not heard is there's too many words in the email. There's too many words in the conversation. Things need to be succinct, more succinct than ever. Cohesion is making cohesion from chaos. We are in uncertainty and chaos. And this means reinforcing that everybody holds a piece of the puzzle, and what we're experiencing is normal. Like, we are experiencing chaos because there is chaos. And as opposed to trying to make it coherent when it sort of acknowledges my reality. The cohesion part is reinforcing that we're working together and building and letting people speak vulnerably and freely, even if what they want to speak is venting something. Being heard is really important in terms of creating cohesion. And try not to reinforce your own self-interest, and try to use we more than I. Connection, clear, we need to be human, present, available. That gets back to what do you do on the first day of work, the second day of work, how do you check in with people? I've heard over and over again that people are deployed, have not been asked how their deployment was or debriefed. Communication, the don't is, don't assume people know or can provide same information to others. Don't like play telephone. Remember that game of telephone? Might be dated, but if it's not, it's where things get passed on, but they don't get passed on right. You have to have a communication method that's multifaceted and effective for all different kinds of learners. And courage is the most important part, because we have to have courage as leaders. We have to be courage to fail, courage to hear feedback, and courage to be proactive and take responsibility for our actions. If you're a middle manager and you're saying to your staff, that's what my boss said, I want to encourage you to think about how you can metabolize that better for your staff. That's not good for your staff to just communicate despair. And I'm going to end with a couple of quick notes and then take some questions. These are just two ideas that sum up what I've said. Examples of reflective leadership or reflective supervision: being curious, staying curious, and the capacity to see and feel without reacting. We call see, be, do. Can you see what's going on? Can you be your values before you do? We're all very action-oriented, and in this state, sometimes more action-oriented. But if you see what's contextually happening and you be your values, what you do will be more aligned. And relational leadership is really what anybody would expect in a relationship: gratitude and appreciation, consider whole person, understand that people are definitely more triggered right now, and there are going to be many more micro and macro aggressions that we all are going to make, and particularly those of us with privilege and those of us that are not conscious of what we need to do. And as leaders, we have to understand that we're in a time of great emotional and vulnerability. And it's important to be transparent. A second about HEAL-SF, and maybe I'll take questions. This is an example of something we've done in response in San Francisco. The mayor authorized HEAL-SF, which is a collaborative effort for San Francisco public and private and nonprofit healthcare providers to work together to develop an aligned approach to our workforce and our community. Often responses are well-intentioned, and often in San Francisco, there's like as many tables as there are people sometimes trying to solve problems. I like to call it a city of initiatives on steroids. So HEAL-SF is designed to bring those initiatives together into a unified effort. It's about logistics, coordination, and expert guidance. And here's how we've responded to our workforce and our frontline workers in terms of individual interventions, broad mitigation, systems transformation and prevention with wellness, and systems and leadership trainings, streamlined resources, and a pro bono network and EAP to respond to ongoing crisis and trauma. Some of the things we've done is also on our HEAL-SF website. We've developed clinical guidelines for COVID-19 response. We've developed rapid response phase and recovery phase supports. And as I mentioned before, we are in the process of almost finishing our workplace return and recovery checklist. So sum up, focus on organizational healing through trauma-informed systems. I talked about seeing, being, and doing. There's an incredible opportunity now to align and coordinate our efforts, and leadership can and will buffer and can mitigate further risk and loss. We are capable of doing that. Here are the resources I mentioned. You have this, the websites, and I just want to end before questions with some wise words from Nelson Mandela. May your choices reflect your hopes, not your fears. And if we can work in that way, we will courageously move forward. I thank you for your for what you've done and what you're doing. And here's our contact information, and I'm open for questions.
Great, thank you so much, Ken. So during this portion, we would like to transition to a little bit of question and answer. So if anybody has a question, please feel free to write it in the chat box or raise your hand. And while we are waiting for questions to come in, MAPC does have a few questions that we actually would like to ask Ken, just to get the conversation started. So the first one, I speak for myself on this question, and I think trauma-informed systems change is a relatively new concept for a lot of people. And I'm curious if you could provide one simple action that everybody can start to implement within their work as it relates to COVID-19 recovery efforts.
Mm-hmm. So I'll just go back to the example I gave before. The best example of trauma-informed systems is Relational right now, instituting the check-in. Now, it's gonna, whether it's in an individual check-in or a group check-in, and maybe y'all can come up with a better word, that's like from the 70s. So if you have a, better way of calling it, I'm happy to, relate it somewhere else. But it should take no more in a meeting than 5 minutes. And if you're not already doing it, it could be people saying one word as they're starting the meeting about how they're feeling in their body, mind. It could be a mindful moment. If you have enough time, it could be people talking about what's on their mind. It could be a check-in using, given that we're on video, we use some I was going to use it today, but you could use on Facebook and other, you can see like sort of these images of which cat are you, and you could pick which cat you are, and there's the angry cat and the cat in the refrigerator, and they can put their number. So there are funny check-ins. I could share all of those with you. I've got like 1 million different check-ins, and if you want them, I can give them. And individual check-ins. They take a little bit of your productivity away, but I will say, unless you're different than everybody else in the world, your productivity is lower anyway. So I think you'll be more productive if you check in and then people are actually mindfully in the room and it brings them in the mood. So that would be one very specific task, both individually. If you're somebody that's deploying people, will you make sure, please, that every deployment ends up with a debriefing, 15 minutes or 20 minutes? I have said of the 50 people I've talked to that have been deployed, 49 of them have not been debriefed. So I don't know if Boston's doing better, Yahoo, but it's not happening in New York, Seattle, Santa Cruz, San Francisco. So the last thing I'd say is really ask them what's happening for them before you send them back to work. And a first day ritual coming back to work. They're coming back to the workplace.
Great.
Just a quick list.
Thank you for sharing that. Yeah, that's really helpful. And another question that we have for you, COVID-19 really has exposed a lot of unaddressed systemic issues such as housing, income, race, and to no surprise, it really has affected specific populations disproportionately, such as the Black community. And you touched upon this, but with recent events that are happening now across the nation with the Black Lives Movement, how can we show our support for the Black community that is sensitive to past and current trauma this group is currently has faced?
Mm-hmm. Ask, I guess as a white man, I guess I would assume that I know how to answer the question of how and what the African-American community needs. On the other hand, I know what the African-American community and Black and brown people need in general is for me to speak up when I need to speak up and be quiet when I need to be quiet. And sometimes I will not get that calculus right. And I need to keep doing it. And I need to move beyond this is a crisis. And when it calms down, go back to what I was doing. I need to bring it up in every meeting, every space, every place, look at every policy, understand why our organizations are not promoting African-American staff, understand how it is in our organizations that African-American staff have been left behind or have experienced inequities, and don't create another committee, but actually use a policy and practice formulation to address it and change it and build permanent structures. Particularly, I'm speaking to my white and non-Black colleagues. I think this is a life's work, and as my colleague and friend Ken Hardy said, is that when people confront him about why it is he always brings up race as an African-American man, he says that he'll stop bringing up race when white people bring up race. So I think my lesson from that is this is not a crisis. This is embedded into the structure of our system, and it's going to take, and maybe we're in a moment where we can look at the practices and our own behavior relative to supporting the ongoing ways in which inequities are embedded and baked into our system. And I think trauma-informed systems is a great model for that because it builds into it a process of humane and relational leadership that needs to allow for holding. I know I need to hold the pain as a leader and not talk about and not give it back in no way, but I need to hold the pain sometimes, and sometimes I need to do something about the pain. I think trauma-informed systems gives us a model where we understand that it is part of our job to hold the pain. Many of us don't feel comfortable with that and then just start acting or reacting. The pain is real, and we can't make the pain go away. We can't make 400 years of history go away, but we sure can begin to address how we reimagine our work, our training, and our organizations. And that's the core of trauma-informed systems.
Great, thank you so much. At this time, if you have any questions, please enter them into the chat box and we will do our best to answer them.
I was just going to take a moment to offer, and for everybody who joined, I'm Barry Kepler from MAPC. I think it's in moments like these too where I think we might perceive the absence of questions as if people don't have questions. But I guess I've come to think more and more, and based off what you're saying, Kem, too, is I think we're sitting with this new knowledge, and we're sitting with both kind of the approaches, but also the understanding that you've kind of helped and make us aware of today too. So just wanted to recognize the silence itself might just also signal that kind of the processing and thoughts that are going on related to it.
It's a lot of information, Barry, to absorb. I see it's great information to absorb. I just went through like 8 hours of material in an hour. So if you're overwhelmed by what I said, I think I wouldn't blame you, and I wouldn't know where to ask a question, but somebody might ask a question of where do you start? Like, where do you start developing a trauma-informed system? And I think there are probably 3 places you need to start. One is you need to decide you want to go forward in some sort of organizational culture change. And that's important. The second thing is I would align myself with all culture change in your organization, because if you're in organizations like I was, there are a million different culture change efforts within one organization. It's like, you can't even remember the names. When we first did a survey of how people liked our training, they said they loved the training. They thought it was really helpful. They thought if they were trauma-informed, it would actually change the way they did work. I remember specific stories about a housekeeping person at Laguna Honda Hospital that said they all of a sudden understood that if they, the reason why the patients whose rooms they were cleaning were so grumpy, they thought they were just bad people. So there were these remarkable changes that happened. But the truth is that if you're going to move forward, you need to decide that you're going to align yourself with your equity efforts, your culture change efforts, your QA efforts, so it doesn't become competitive, it becomes both and. And the third thing is you need leadership engagement. Leadership has to, at least tacitly in the beginning, buy in. So we do have a way, if you look on our website, traumatransform.org, you'll see that we have a way of entering into organizations that help build the culture change. But it always feels overwhelming to start.
We have one question coming in saying that this is helpful context for how to be a leader. Do you have any suggestions for staff who aren't supervisors or managers to begin implementing and modeling these practices?
Mm-hmm. Well, first I'm going to say that no change ever starts from the top down. So, you know, nothing ever has changed from the top down, which is why what's happening today, hopefully with our young people and others on the streets, will create some change for the betterment. So what we did is we understood that, and we developed a champions learning community, and champions are line staff. So this was really started by line staff and champions saying we need some change, who met together and then came forward and asked for a method for leadership to change. So I'd say if you're a line staff and you don't supervise anybody and you're interested, you know, check what do we have on our website, look at it, meet with a couple of people, see what makes sense, and work on it together in terms of then bring it up to your supervisor. An example of that is you may all do like surveys of your staff in terms of their staff wellness or happiness. One of the surveys the Department of Public Health did showed that one of our department staff were feeling disrespected. You often would feel like it would be hard to fix disrespect, but the leader went, given with that data, using data, went to the staff and said, what do we need to do? You know, you're feeling disrespected. And they developed, you know, a number of things they did over 18 months, and they moved their staff from 33% less disrespected over 18 months. And if you ask the leader what changed them the most, she would say, and the staff said, is that somebody asked. You know, because if I'm feeling disrespected and nobody has ever listened, so this is for staff and leaders and supervisors, that if you can create reflective space, things are heard differently. So to the person who is not supervising, I'd say meet with a couple of colleagues, look at some materials, start a little learning community, and bring some information to your supervisor and get them intrigued.
Thank you, Ken. I think at this point, I'll turn it over to Barry for some closing remarks as we're approaching our time here.
Thanks, Colleen. So again, just want to say thank you again, Ken, so much for making this time and joining us. Yeah, thank you so much for giving your time to do this too. I think the thing I'm left with is that, and this is mainly just I want to be able to implicate myself, is that it's very easy to think about the numbers or think about the units or think about the physical things. And it particularly struck me when you were talking about reopening. I think we've been thinking about how does the storefront open, how does the street get reused, how are transportation, and to some degree kind of overlooking the human element that's both involved in that kind of reintroduction or kind of renewal piece of it. But then also what does it mean to kind of sustain ourselves during that time too. So thank you for those thoughts. And I know the one thing I can walk away from amidst all this too. So I want to say thank you everyone for joining us. I'm just going to do a quick check with Sasha to see if there's any final items. But again, thank you all for joining us and making time for this.
Thank you, Barry. Just to reiterate, thank you to Ken and Barry and Elaine for hosting this webinar and for the incredibly valuable information that was shared here today. We will be sharing a recording, as I mentioned. Thank you all for joining us. We are also hosting a webinar tomorrow at 3 p.m. to explore creative ways that we can use our streets during this time. And I hope that we can bring this human element into that conversation as well. So we hope that you can join us, and we will share the link to that in our follow-up email if you have not registered already. Thank you for your time, everyone, and have a good day.
Thank you all.
Thank you.
so much.